When you have a patient that has an upper cervical fixation around occiput C1, C2, we can approach this problem with the cross-contact adjustment, which is an advanced technique, which not only will release that fixation in that region, but also stimulate the vagus nerve at the same time. What we'll do is we'll come into the upper cervical using the point mode.
C4, C5. C1, C2.
And to get to the point mode, you can do that a couple different ways. You can double click the button on the impulse head, or you can choose point from the screen itself. I'll double click the button here.
Point.
That puts us in the point mode. We're going to use 10 pounds for the upper cervical, which is normal for an adult, but you can use 5 pounds to begin with if it's a younger patient or even a much, much older patient as well. We always try to start with the lowest force level because we can always increase the force later. Using the cross contact, I'm going to approach the upper cervical by connecting with the C1 body and the spinous process of C2. Before I start the adjustments, since I'm on the left side of the patient, I'm going to ask the patient to look to the right, but only using their eyes. So go ahead and look to the right side for me, but only using your eyes. We'll then apply pressure to get to the point mode. The point mode goes from 4 impulses per second all the way up to 90 impulses per second, and then back down to 4. And by working with all of those different specific frequencies, the upper frequencies will relax that area, resolve the fixation, and the lower frequencies of about 4 to 8 will excite that vagus nerve and be able to relax the patient as well. So go ahead and now I'm going to move to the right side, and I'm going to have the patient then look with only their eyes to the left side. And then for the last adjustment, we're going to come right in P to A, and we're going to ask the patients to look down towards their toes or nose in this case as well. Now, be careful with this adjustment. It is very powerful. So if the patient is a little dehydrated, they may become a little bit dizzy when they get up off the table. In that case, you want to go ahead and sit them down and have them have some water and relax a little bit. You'll also find that some patients will say they're very tired after this adjustment because that vagus nerve has been stimulated. They may relax quite a bit. So you may want to have them relax for a little bit in the waiting room before you send them out. But that will take care of not only the upper cervical problem, but also the vagus nerve stimulation to relax those patients. I've done this in the prone position with a patient. I like that because we have the face piece so that they don't look with their head to the left and right, but only with their optical nerves. But you can, of course, do this in both the seated and the standing position as well.